Hello and welcome back to the channel. A bit overcast today. If you're new here, my name's Gemma and me, my Australian husband, our 2-year-old daughter and this dog I'm walking are making the move to Australia in 2026. So, quick update since my last video. We have now signed up to a migration agency, so we're now busy getting on with the application. So hoping to have that in as soon as possible. Now that we put some money down and started the application, it definitely feels a lot more real, and so it's quite exciting, getting excited now. So yeah, because of that, the decluttering has ramped up like mad, so anything that can be sold I'm just selling now and we just make do. I've also contacted some pet relocation agencies and they're saying about 6-7 months at the moment, so I thought we'd have to start the process for that soon, but I think we've still got a little bit of time. That's where we are at the moment. So the next thing will be the dog, and we're still finishing up doing the house up. So yeah, very busy at the moment. So today's video will be on the Australian healthcare system that unfortunately we had to use during our trip in February of this year. And I was meant to film this a little while ago but I had trouble, but I'm glad I didn't, because unfortunately we had to go to A&E here the other day. So yeah, I'll be able to do a really good comparison. Now, if you watched my earlier video on how to survive long haul travel to Australia with a toddler, then you'll know that unfortunately within 24 hours of landing we had to visit A&E. So yeah, that was fun. So this video I'll share with you exactly what happened, how the healthcare system in Australia compares to the UK, and if we think it's really up to the hype. So quick disclaimer, this isn't medical advice. I'm simply sharing with you our experiences of the healthcare systems in Brisbane and the Sunshine Coast in Australia and Suffolk, England. So before we get started, I'm going to share with you 5 differences between the UK and Australian healthcare systems. So, number 1, you can book an appointment around your schedule. So there's no ringing the doctors first thing in the morning and waiting in line to get an appointment that day. You can pick an appointment online, and most importantly, you can see the doctor in a timely manner. There's no 3-week wait, unlike here in the UK for non-urgent matters. Number 2, in Australia there's the option to get some services bulk billed. What does that mean? It means that basically the bill is sent directly to the government, aka Medicare. However, I have heard that sometimes doctors that allow bulk billing can be hard to find. Number 3, doctor appointments aren't rushed. As a patient, you're allowed time to discuss your symptoms and treatment plans at length. Just a disclaimer though, that's our experience from when we use the services, and we did pay for these appointments. They weren't bulk billed, so it may be different for the latter. Number 4, we found testing to be more efficient in Australia. So for example, pathology centres where your bloods are taken. So these can usually be found near doctors, hospitals, or even shopping centres, as we found in Brisbane. So you could get the bloods taken after a doctor's appointment, or the day after, or the day after next. So there's no 3-week wait like here in the UK. Number 5, having a place to receive treatment during a hospital admission. So whether that's a consultation room or a private bay, but more on that later. So here's a bonus one for you if you're considering getting private health insurance whilst you're in Australia. So we found private insurance to be more commonplace in Australia and much more competitively priced. A big difference we noticed from speaking to people is that in Australia they actually expect you to use it regularly. So for example, if you've got dental included in the plan. So yeah, as a patient, that gives you potentially more options if that's a pathway you wish to go down, but obviously you've still got the public system as well. So they are my 6 main differences, so please do stick around if you want to hear a bit more about them in some more detail. So yes, you heard right. Less than 24 hours after landing, our daughter unfortunately bumped her head. So naturally, we panicked, as parents do, and we took her to the local GP, which luckily enough wasn't too far away. When we got there, obviously we didn't have an appointment, so we approached reception. This was around mid-afternoon by this point, and luckily enough squeezed us in with a doctor who was then about to finish his shift. So we literally waited no more than about 5 minutes and we were able to see the doctor, and in that time another member of staff, I assume it was like a nurse, did check our daughter over. So the appointment was about 15 minutes and wasn't rushed at all. He had no concerns, which was really good and really reassuring, because this was like the first accident our daughter had. He just advised us to go to hospital just for observation as a precaution, because it had swelled up quite a lot by this point. And also in that time he wrote us a letter to take to hospital to give to the team there to speed things along. So yeah, it was really fantastic. We just left feeling very reassured that everything was fine and she didn't seem like she was in danger. So we hopped in the car and drove the 40 minutes to the hospital. I forgot to mention there that we did have to pay for that appointment, so I'll pop here how much that was. So how does it compare to the UK? Well, unfortunately our daughter had a little accident here recently, so our first instinct was to go to the doctors, and we're just hoping that someone could just quickly check her and just confirm what we thought. But unfortunately, because we didn't have an appointment, we couldn't be seen. Apparently there was an on-call doctor. I did ask how long to be seen, and he said he wouldn't know for a few hours when they'd be available. So based on that information, we took ourselves to A&E, which was about a 25-minute drive away, luckily. So we arrived at Brisbane's Children's Hospital and headed straight to reception. They asked for a few details, obviously, like if we had any private health insurance, which we had, and also travel insurance. But after finding out that we were from the UK, they said thankfully there wouldn't be a charge because there's a reciprocal agreement between the UK and Australia. So that was really good news, saved us some paperwork. So we waited in reception for about 10 minutes. I think at the time there was only one other family in there, which we were quite surprised at, because this was now sort of approaching tea time. We were taken to triage, where again we told them what happened to our daughter, shared the letter from the GP, and following that, which was about 5 minutes if that, she took us to a private bay for assessment, and we were pretty much seen straight away. All my daughter's vitals were taken, and then we just had to wait to see a medical professional. So in that time the nurses did ask if my daughter was hungry, because as I said, it was now approaching sort of dinner time. We were happy to go and buy something, but they were actually happy to offer us something for her to eat. So I think she had like a cheese and ham sandwich and a yogurt. So yeah, super grateful for that. It meant none of us had to leave, because obviously we were still really worried. So we're in that private bay for a little while. We were told that we needed to stay for observation for about 4 hours since the accident happened. So by this point, really, we only needed to be at the hospital for around 2 hours. So once they were happy, they moved us on to like the main ward. That's where we were going to stay for her final observations. We were monitored regularly and they took her vitals. We were discharged about 9 p.m. We were given a letter and some more guidance to follow, and then sent on our way home. But I can't rate the experience enough, really. It was absolutely fantastic. So how does this compare to our experience of A&E in the UK? Well, for our daughter, we've had to unfortunately attend twice now since she's been born. The first time we were there about 6-7 hours in total. She was very little. She was probably about 6 months old. We had a brief consultation in a side room, but the rest of it was in the corridor. So she had to have 2 blood tests. They were taken in the corridor. The outcome was delivered to us in the corridor. So yeah, it wasn't great, but again, no fault of the staff, they were super apologetic. So more recently we had to attend again, and thankfully this time it was a lot quicker. We were surprised that we had to queue just to get into A&E. They got a new building, so there was about 5 of us in the queue at this time. Thankfully it wasn't urgent, we just wanted to get that double checked really as per guidance. So yeah, we had to queue just to get into A&E, so that's to be triaged. And then once we were triaged, we then had to go to reception to be checked in. So took our details, and then we went to the waiting area for paediatrics, because this was a general public hospital. We don't have private A&Es here in the UK, everybody goes to a public hospital. Once we got checked in the children's area and somebody assessed us just to be triaged, she did tell us it was around 2.5 hour wait, so not too bad. So then we went in the waiting area, and there was probably at this point about 5 other families there. It was lunchtime at this point, so my husband popped out to get us some bits to eat, and then yeah, we got seen by the doctor, and thankfully all was okay and we got to leave. So all in all, I think we were there in total about 3 hours, so not too bad by A&E standards, but as I say, can't fault the care we received from the staff. To be fair, it seemed like things are working a lot better this time. Hopefully I won't have to go there again, but if I do, I'll let you know. I suppose the main difference between the two was that whilst we were under observation and getting treatment, we were in a private bay, or had a bed at least, whilst we're in Australia, whereas in the UK, based on the 2 times we've had to go now, that wasn't the case. You'll see somebody, a medical professional, and then you're sent back to the waiting room, and then if they need to speak to you again or need to do any more checks, you're taken maybe back into a room, or as I said, it's done there and then in the waiting room and then sent back again. So there are private bays, but I assume there's just not many of them, and they're safe for the most urgent cases, so that would be the main difference, I suppose. So that's just a comparison of our experience of A&E for our little one, both in the UK and Australia. We were comparing a children's hospital in Australia where we went to a general public hospital here in the UK, so maybe that's a bit of an unfair comparison, I don't know, but if we were to fairly compare it, then it would have to be a children's hospital here, but sadly we don't have those. Our closest one at the moment is London, which is 100 miles away, or 160 kilometres. I know they're building one in Cambridge, but again, that's nearly a 2-hour drive away. So yeah, we just don't really have those things here, which I'm a bit surprised about really, considering that the UK is a lot smaller in comparison. Relatively, we're not as far away from things as in Australia. So yeah, let me know your thoughts in the comments. So unfortunately that wasn't the end of our experience of the Australian healthcare system. My husband had to also visit the GP whilst we were there towards the end of the trip. He got some kind of bug, had it a few days, and unfortunately none of the over-the-counter medicine was working, and if we weren't travelling home a few days later, I think he perhaps would have rid it out a bit longer, but we're a bit worried about getting on the plane, should we say. So he booked a GP appointment. So he booked that the evening before, I think it was, and it was all online, so he could select an appointment that was most suitable to him. So he managed to get one first thing in the morning when they opened. These weren't bulk billed, as I said before, so he did have to pay for this one. So he turned up to the appointment and spoke to the doctor, and he said the doctor was really good. Again, didn't feel rushed. Asked what the problem was and what he needed, so it's basically some meds to help him get on that flight. Because of timescales and things, perhaps we'd have done some tests, but unfortunately that wasn't an option, so just to check what bug it was. So yeah, I managed to get some medication, and thankfully that was already starting to work within 24 hours. I'll pop again in here how much that was and how much the medications were, but really impressed, because here in the UK it's a case of ringing up There's usually first thing in the morning for a morning appointment, and in the afternoon for a afternoon appointment. And you have to call up and then you're placed in a queue, and you just got to hope by the time you get to the front of the queue there's an appointment left. So again, we've been quite lucky here for our experience of getting appointments for urgent things. So an on the day appointment, it's for those non-urgent matters that we struggle. So like my daughter, for example, we had to wait nearly 3 weeks for an appointment. Again, wasn't serious, thankfully, life or death, but again, it was impacting the quality of life a bit. So we had to wait 3 weeks just to get that first GP appointment. So that's the difference really. So it does seem like in Australia it suited more to book appointments that fit around your schedule, and you seem to be able to get those relatively quickly. Most recently my daughter did need a blood test and she had to get that at the hospital, and again that was nearly a 3-week wait just to get a slot at the hospital, where, as I understand from speaking to people, there's like pop-up shops, I suppose, around Oz where you can go next door to the GP and straight after the appointment almost you could, or that day or the next day, you could go and get your bloods done. So yeah, it just seemed a bit more efficient over there, but obviously you are having to potentially pay. So I don't know, is that better, is it not? Let me know. So private healthcare, what are the differences? So here in the UK we currently pay £134 a month for private health insurance, and I'd say that's like the lowest level of coverage. It doesn't include dental and things like that, whereas in Australia, when I checked prices around 3 months ago, we could get, I think they call it like the hospital essential plus silver package, and that was $248 a month, so around the same. But the main difference we found from speaking to people there was that in Australia they actually expect you to use your private health insurance, whereas here what we've found is you don't use it unless you absolutely need to. So it's kind of like a piggy bank for a rainy day, and you pray that you'll never need to use it, or you're going to use it in an emergency. So that's the main difference really. So I do feel like you get more value for money in Australia, and also they do encourage you to take out private health insurance over there, as they've introduced a Medicare levy surcharge, I think it's called. So basically if you earn over a certain amount you might have to pay a percentage as a surcharge to the government, unless you have a certain level of private health insurance taken out. So I'll pop a link in the description to more information on that, because I'm not an expert. But yes, it does seem like it's a fairer system to help relieve pressure on the public system, and those that can afford to pay a bit more are encouraged to do so. So yeah, they're the main differences. So let me know your thoughts. Do you have private cover in Australia, or are you happy with the treatment you've received through the public system? So let me know in the comments. Also, just to add on that last point, I'm hoping any Australians watching can help to clarify. I get the sense that in Australia, if you do choose to go down the private route for a treatment, you only pay the difference between what the public amount would have been, whereas in the UK if you go privately you have to pay the full whack. So for example, if you needed an operation but you wanted to go private, you'd have to pay the full whack. So what it would have cost on the NHS isn't discounted, whereas I feel like you just pay the difference in Australia. So yeah, as I said, let me know, is my understanding of that correct? So what are my final thoughts? So firstly, to say that the care that we've received here in the UK under the NHS has been exemplary, and we are super grateful that a service like this exists here and that it's free. However, I do feel that for non-urgent matters in Australia it's much more quicker, smoother and less stressful. Would our experience be the same under Medicare alone? Who knows? But for us it seems like mixing Medicare with private insurance gives us the best of both worlds. What do you think? Have you used healthcare systems in the UK and Australia? Let me know your comparisons and thoughts in the comments below. So lastly, all that's left to say is thanks for watching, and if you want to hear more about our big move next year, then please do subscribe, like, to follow along the journey. So thanks again for watching, take care and see you next time. Bye bye.